Hi, my name is Valerie Bonnet, and I would like to tell you a story today. I am a traditionally trained medical doctor. I did family medicine, I did obstetrics, and I saw a lot of women in my practice. And my story today is how I became disillusioned with the care that I was providing for women and how I was introduced to a better way of taking care of women and everybody, actually. So, anyway, I went to the University of Iowa for my medical training and ended up in a family residency program in the Quad Cities. And my first rotation was obstetrics, and I was hooked. I loved delivering babies. It was, so exciting. It was so happy for the most part. It was just such a miracle of life, and it was just awesome. Loved it. I worked with some of the best nurses, the best human beings that I've ever worked with. I worked with wonderful medical doctors who helped train me and teach me, and the stuff I learned from the nurses, it was fantastic. So I was like hooked with doing obstetrics, but I did it as a family practice doctor. So kind of a cross between a doctor and a midwife. I spent a lot of time with people. I was in the hospital. I was at the bedside. I tried to be minimally invasive when it was appropriate to do so, to keep people and their babies, women and their babies safe. But anyway, I love doing OB. So if you like doing OB and you're in a family practice residency, you end up doing a lot more OB. Maybe you deliver some of the people that are in your peer group. Maybe you deliver their wives. You deliver the babies that of the people in your practice when maybe the other doctors didn't want to do OB. So I ended up getting a lot of experience in OB. And in fact, my first 5 years out of residency, I worked with low income clinics and provided OB and well woman care. So anyway, the point of that is I did a lot of women's health care. I got out into private practice. I continued seeing a lot of women in my practice, and I was, just doing what everybody else did when it came to caring for women. As an example, if somebody came in with depression or anxiety, I would do the standard of care, which was writing for a prescription, usually for an antidepressant or an anxiety medication. If somebody came in with heavy periods or painful periods, I'd write for a birth control pill. If somebody came in with insomnia, we'd talk about a little bit about sleep hygiene, but I would recommend an over-the-counter medication or even a prescription at times. And what happened is I started seeing women coming back into the office, and like specifically with antidepressants and anxiety medication. And a lot of times what they would say is, I felt really good for a little while, but then it stopped working. And so what do you do from a traditional medicine standpoint if somebody says it's not working anymore? Well, you increase their dosage, you maybe change to something else. What if they've had side effects, like they're fatigued from their antidepressant, or they have decreased libido? Well, sometimes it was recommended that you add a second agent to that, even though there's a risk factor for serious adverse effects when you're mixing and matching medications. And then I would see that lady who had been on an antidepressant since it was released to the public 20 years ago, and she couldn't get off of this antidepressant. And so I started getting skeptical and thinking, maybe this isn't always beneficial, using medications. And so about the same time, I was starting to get some skepticism And, looking at some of the information from the pharmaceutical companies where they would show the studies showing the safety and effectiveness of these medications. And the studies were 6 weeks to maybe a few months, but not long-term studies to show that they were safe. So anyway, I started getting a little skeptical. At the same time, I was introduced to the concept of functional medicine. And functional medicine basically is looking at the big picture when looking at a person's overall health. So, what are the underlying conditions that are occurring to cause dis-ease in a person? And as part of that, a big part of that is looking at hormonal health. And in women specifically, looking at what I'll call the big five hormones in women. That's estrogen, progesterone, testosterone, DHEA, and cortisol. And so I learned that when these hormones are out of balance, then symptoms can occur. And so I like came back into my practice, seeing women, and started thinking, well, maybe this woman has sleep disturbances, anxiety, breast tenderness, heavy menstrual periods because her progesterone level is low, because she's in perimenopause. And lo and behold, I learned how to test those hormones accurately. And I would have her get a test, and she would do the test, and her progesterone level was low. And I'd have her come back in. We'd talk about how to safely use progesterone. She would use progesterone, and guess what? She would start sleeping through the night. Her anxiety, depression, fatigue, heavy periods, breast tenderness, all of that got better. And I'm like, wow, this person actually feels better because her hormones are in better balance. And it like changed the whole way that I thought about seeing people. It's like all of a sudden, you don't look for medication to treat a deficiency or an imbalance. You look at what's going on at a hormonal level. And it was like mind-blowing. And not only that, the results that people got were so much better. It was just amazing. And it just changed the trajectory of what I wanted to do when I was seeing people, seeing women specifically. So anyway, I changed my entire practice and started doing natural hormone replacement with people, and started seeing people individually. I got out of traditional medicine because I couldn't get the same results with people with a prescription that I could when they get their hormones in balance. So anyway, that's the background for the story that I'm going to tell you right now. So within the last month, and I'm not going to say any identifying information because this is somebody that I saw in real life. I was seeing a woman who I had seen a couple of years ago, and when I initially saw this woman, she was in late perimenopause. So perimenopause is the time period before menopause, and it can last for a few years, or it can last for a long time. I mean, there's some women who start perimenopause in their mid to late 30s, and they can have hormonal imbalance of perimenopause until they actually stop having a period for a year. And that's when they're in menopause, is when they haven't had a period for a year, which is crazy. But anyway, that's the definition of menopause, is not having a period for a year. So anyway, I had seen a perimenopausal woman, and she came in with a lot of symptoms. She just generally did not feel well. She had sleep issues, restless sleep, waking up all the time. She was a little bit irritable. She had anxiety. Her periods were a little irregular and heavier, and she just didn't feel like herself anymore. So, she came to me for hormones, because that's what I'm doing right now. And so we measured her hormones, and guess what? She had a low progesterone level. Everything else was pretty much okay. Her estrogen was okay. Her testosterone and DHEA weren't too bad. Her cortisol, like, I can't recall for sure, but nothing really abnormal except for a really low progesterone level. So I recommended that she use some lower dose progesterone cream. And she did. And she felt better, until she went to go see her regular medical doctor for her yearly exam. And her regular medical doctor asked if she was, what she was doing with supplements, meds, hormones. She told her that she was using progesterone, and the doctor was not happy and said, "You should not be using this. It causes cancer. I want you to get off of it." And she was really upset. And my client was like a little surprised, because it's like she knew she felt better using progesterone. So why would this medical doctor be so against it? And so anyway, the client listened to her doctor and got off the progesterone, and, of course, started to have those symptoms again. And actually, since she was so close to menopause, she developed some new symptoms from low estrogen level. And so I saw her again, and we retested her hormones and discovered that she was, now low in more than one thing. So got her on those things, and I haven't heard back from her yet. It's been relatively recent, so I'm assuming that she's going to feel so much better with getting her hormones in balance and getting everything into ideal range. She's going to feel so much better, because everybody else does. All right. So my client, when she saw the doctor, she asked the doctor, "Well, what happens if I start having, symptoms again? What if I can't sleep? Or what if I can't, what if I get anxious or irritable again?" And the doctor said, "If that happens, we will treat your symptoms. If that happens, we will treat your symptoms." So the doctor was planning on using medications for the symptoms of hormonal imbalance, instead of correcting the hormonal imbalance. And, that was really frustrating for me, okay? Because I have the medical training. I know what the protocols are. If somebody comes in with depression or anxiety or heavy periods or sleep disturbances, I know what the standard of care is in the medical field, okay? I know what that is. I know what the prescriptions are if somebody comes in with those symptoms. But I also have the extra education in how to use natural hormone replacement in low doses safely, so that people can get into their ideal hormonal range and balance, so they don't need all those pharmaceuticals. And the problem with pharmaceuticals is they're not naturally occurring substances, And when we put something that doesn't occur in nature in our body, it can really interfere with our physiology's ability to get back into homeostasis. So homeostasis is just the idea of balance. We need to have a very, very tight control over things like our blood pH, our sodium level, our potassium level, and our neurotransmitter levels. And when we start using medications that interfere with our natural processes, then it's very, very hard to get back into homeostasis, and other things can happen. So anyway, that is a story that I wanted to share to encourage women that, hey, number one, there is hope for these symptoms. If you're having hormonal issues, work with somebody who really truly understands not only the hormones, but also the underlying physiology. There are a lot of people who are on Facebook groups that are giving advice to other women, and frankly, some of that advice is very, very dangerous. For an example, I saw one woman who was complaining that she was having heavy bleeding on high dose estrogen, and somebody put a comment underneath her post saying, "Oh, you just need more estrogen." No. If you're having heavy bleeding and you're already using a lot of estrogen, that's potentially the worst thing that you could do for that. Another thing is, people are using hormones when they don't need hormones. So a lot of women are going to their medical doctors and they have hot flashes, night sweats, and a whole bunch of symptoms of estrogen deficiency. And so they get put on estrogen replacement, but they never do a test to see if their estrogen level was low in the first place. And if they would have tested their levels, a lot of times they will find that hot flashes can also occur when estrogen levels are too high, or when estrogens are high proportionately to the amount of progesterone that somebody has, or if somebody's cortisol levels are too high, or even if their vitamin D is too low. So if you treat symptoms without testing first, that can be very dangerous. We don't need very, very high doses of estrogen. We don't need to have very high doses of testosterone. A lot of women are on testosterone pellets or injections or creams, and they don't need those extremely high doses, and they have a lot of side effects from that. So anyway, wanted to share a story. It was a lot longer than I intended, but the bottom line is if you have hormonal imbalance symptoms and you want help with that, find somebody who can help you. Find somebody who has the background where they understand the medicine and they understand functional medicine and the correct testing as well. I can help you. I understand this stuff, I know this stuff, and I can help you understand it as well. But I can't help you if you're not motivated to learn about it, and if you're not willing to invest in yourself a little bit. I see online all the time, or with even people that I've seen in the past, they don't want to come in. They don't want to pay the money for the testing. They don't want to pay for my time. They're like, oh, it's so expensive to get this testing. It's so expensive to see you. And I'm like, well, you know what? If you knew the loss, the expense personally that it took me to learn this information, you would see it's not expensive at all in comparison. If you could see the benefits that you can have by having your hormones in balance, it's not expensive at all. How much money would you save to not get breast cancer? How much money would you save to preserve your memory and not get dementia? How much money would you save by not having a hip fracture when you're 70 and end up in a nursing home? How much money are you going to save if you don't get divorced because you're so moody and irritable that your husband is at a loss, or your kids don't want to talk to you because they can't, because they don't know how you're going to react? Hormonal imbalance is extremely important, and it can help a whole bunch of things. And if you are willing to invest in yourself and you want me to teach you, guide you, and help you to get your hormones fixed, contact me and we can decide what's the best way for us to either work together so I can help you, or help you find the person maybe in your geographic area or whatever to do that. So I will post some information below this video on how you can contact me. But number one, there is hope. I have several women. I also have a private group, and several of the women in that group had severe fibromyalgia. And they were told by, they probably between them had seen, an average of 8 to 10 doctors each before they were diagnosed. And a lot of times told, well, we can treat your symptoms, but you're not going to get any better. So you need to just learn how to live with this. And by getting their hormones in balance, they're better. I'm not going to say that they don't have some mild symptoms, but some of them are entirely, they don't have fibromyalgia anymore, by just getting their hormones in balance. So their quality of life is so much better. What would that be worth? Anyway, like I said, I went way over what I was expecting to talk about, but if you've been here to the end, thank you for listening. Have a wonderful rest of your day. And if you're ready to finally learn about and become the master of your own hormones, then contact me. All right? Thanks very much.